Yeah, Nina Pham is actually said to be in good condition. You know, in that YouTube video that you just saw, you can see her smiling. She appears alert. She's even making jokes with her attending physician before leaving Texas Health Presbyterian Hospital in Dallas. Public health officials say the decision to move her to the National Institutes of Health not a reflection on any change in her condition, but they want to take some of the burden off of her Dallas hospital, where many of the medical staff are now out of service as they undergo active monitoring after treating now deceased Ebola patient Thomas Duncan. Public health officials also say they want to give Pham state-of-the-art care. NIH, of course, runs one of the nation's 4 biocontainment units with equipment and staff dedicated to patients with infectious and highly dangerous diseases. Martha?
All right, so we also mentioned the person on the cruise ship at the beginning of the show today, Jonathan. What's that all about?
Yeah, well, the person on the cruise ship is also an employee of that hospital in Texas. While she did not have direct contact with Thomas Duncan, she may have handled blood samples or other specimens from the patient who eventually died from Ebola. Now, she and her husband went on that cruise at a time that the CDC was only requiring medical workers to do self-monitoring. The agency has since upgraded its policy to require active monitoring. The ship's doctor has verified that this woman and her husband remain healthy 19 days after her last possible exposure to Ebola. Remember, Martha, the maximum incubation period for this virus is 21 days, so she's just 2 days shy of that. However, out of an abundance of caution, she and her husband have agreed to isolate themselves inside their cabin, and the State Department says it's working.